All right, I think we'll go ahead and get started. Welcome to all of you, and thanks for joining us tonight for this important webinar. My name is Kate Reisinger, and I'm the Senior Director of Sports Performance at USA Fencing. We're really thrilled to have Dr. Jeremy Summers and Dr. Mariam Zakhary joining us tonight to walk us through some tips and tricks in order to travel safely this season, both internationally and the tips and tricks can also be used, of course, nationally as well. Dr. Summers is USA Fencing's Director of Sports Medicine, and Dr. Zakhary joined us from Mount Sinai in New York City. Mount Sinai is the official medical provider of USA Fencing, and we can't thank you, Dr. Zakhary, and your team enough for your amazing partnership. Also want to give a big shout out to our athletes and coaches. You continue to amaze us every day with your resiliency that you've shown throughout the pandemic. And also the coaches for working so hard to get your athletes out on the strip and performing well. We wish you all the best of luck this season. And finally, I want to recognize our amazing parents. As a mom of an athlete myself, I understand how much you want your kids to be able to compete in a safe environment and know how important sports are, both to our kids' physical and mental health. So here's to you for all of the hard work that you've put in getting your kids traveling internationally. So thank you so much. A few housekeeping notes. If you have a question, please put it in the Q&A and we'll either answer the question live on the webinar or in the chat, not the chat, but we can type it also into the Q&A. We are recording this webinar and we'll post it on our website later this week. In addition, the materials we'll be sharing will also be emailed out and also posted on our website. All right, guys, so let's get going. Over to you, Dr. Summers and Dr. Zakhary.
Hey everyone, thanks for joining. Really appreciate it. Dr. Z, say hi.
Hey everyone, so happy to have you all here. And Kate, thank you so much for that welcome.
Perfect, thank you. So we want to start it off today. We know that international travel is here and we have some teams leaving very soon. Dr. Zakhary, Kate and I all had a conversation a couple weeks ago. We wanted to give you guys some information about international travel during the ongoing pandemic, and that's why we're here today. We've developed a PDF document to give you some good tips on the road to keep our athletes safe and our community safe while you guys are traveling. We know that there's quite a few people, not only on this call, but a lot of people traveling every single month in the hundreds, So we want to make sure that everybody's on the same page and being healthy and safe on the road during the ongoing pandemic. With that said, we want to stress more than anything, and I think that there's some heightened concern from families, parents out there sending young kids, these athletes, these young men and women that are growing in their field of fencing, and we wanted to just reach out to you guys and let you guys know that what we were thinking about keeping our community safe. Everybody who's going on these international trips, for the most part, will need to be vaccinated. And the reason why we want to really highly encourage that is because it is a CDC recommendation and it is the best medical practice at this time to keep yourself safe and your community safe, your family safe. The CDC actually has a risk level of 1 to 4. For certain types of countries, and that level 4 or red zone or orange, which is a level 3, CDC recommendations are to be vaccinated before attempting to go to those types of countries. We're going to give you some resource tools as well. Obviously, you can find a lot of information about where you're going, about the information of your destination on the CDC. We are monitoring all the countries that our athletes are going to, and we're kind of keeping an eye on what's going on in that country. And I know that there's a lot going to Budapest, Estonia, Bulgaria, and Sofia, and in Romania here in the next couple months, as well as other areas. Looking at those countries, if you've looked at Europe lately, Europe is spiking in certain areas and actually coming down from those spikes. We do see trends that happen where they go up and it takes a little bit of while to go down, and then it's down for a while, and then it usually goes back up in its next wave. And we're kind of in that red zone, or in that peak phase, or coming down from that peak phase right now in a couple different locations that we're going. And that's why we wanted to have this call with you guys. most importantly, and Dr. Zakhary can speak on this as well if she'd like, is that being vaccinated highly protects yourself from infection. So just being vaccinated and going to a high risk area, you definitely have decreased your significant risk of infection if you're vaccinated. On top of that, if you continue to adhere, and we really recommend from our fencing community that we are united going to these events, and we're doing best practices and showing other countries that we're a united front and you know, against COVID-19, to be honest with you. And what does that entail? Well, that entails doing best practices, and we know what those are. If you're vaccinated and wearing a mask, your risk of infection goes significantly down, even greater. Your major area of exposure is in your international travel when you're in a public setting. And that's what we want to stress in the call tonight, is that you guys know is that we could be going to a pretty high infectious area in a domestic tournament, but our travel and our exposure to the public is significantly decreased in a domestic tournament versus an international tournament. As far as the hours of the flight, be in the airport, taking the taxi, all of those are potential risks of exposure. And the document that we have tries to hit each one of those areas of exposure and give you some tips to be safe. So overall, arching and the summary of things is if you're vaccinated and having a united front from U.S. fencing going on these events, wearing your mask, not only in public settings, but we've been training and actually competing with our masks, and we highly recommend that you do the same. And if you're social distancing, not being in the same vicinity as another person with your mask off for more than 15 minutes or more. Dr. Zakhary, would you want to add anything to that before I show them a couple of resources?
No, I think, well, yes, kind of. Dr. Summers covered a lot of the important points. The fact that you guys are on here now is a great first step, that you are concerned and you are reaching out to have conversations and to gain information on how to stay safe. Being vaccinated, again, is our number one risk mitigating factor, or, you know, even if you do contract the virus when abroad, we do know that you are less likely to need hospitalization or exhibit severe symptoms if vaccinated. Of course, we know that no vaccine is 100% against any virus, but this one is pretty close. And we do know that it's even closer to 100% when we talk about severe illness or need for hospitalization. I think that's huge when we're abroad to not need that. Another thing to point out is that on every one of these trips, there is someone from the sports medicine team there that will know the closest healthcare facility if needed. You have us as resources back at home too. And Dr. Summers has put his direct contact at the bottom of the PDF that will be going out to everybody. When you guys return, you have a whole team waiting too. If you have any concerns, if you think there was an exposure, or just for support, any questions at all. It is a tough time, just like Dr. Summers said. So we did take some time. Dr. Summers put together an awesome PDF with a lot of tips. And just a reminder that last year we traveled when in the middle of a surge as well. And I think that what we found when we looked into all the cases on any trip that did have a positive exposure incident, it wasn't because it was an international trip or it was an airport or an airplane, but it was more because best practices were broken. Social distancing wasn't in play, masks weren't worn. So following these steps really are our best bet in staying safe and keeping everyone around us safe.
Thank you, Dr. Zakhary. Just to correct one thing, for our cadet designated and our junior designated, we don't send any medical staff with you guys, but if you do have any concerns or any emergencies, just let us know. Let me know, and you'll have my contact information at the end of this as well. So the first thing I want to show you guys in this presentation is what Jennifer Yellman helped me out with earlier today. And that's something that you can do before you go. And I'm going to pull this up and share this within my screen real quick. Can you guys see my backdrop here? I want to make sure everybody can see my backdrop. Can you see my backdrop? Give me a yes. A thumbs up. Okay, good. So this is a website that you guys can go to. It is basically a smart traveler enrollment program through the government where you can put your information and sign in. I created an account and I've actually uploaded a couple trips that I have coming up. What it basically does is it lets the embassy know where you are when you're there. It also is a good place to have if there's a medical emergency, it'll be a good place for your family members to be able to contact you, and you can actually get updates about what's going on in the local area. The next thing I want to share is the actual document. And before we go to the document, I'm going to share this little page here. This is on our world data in data. It's a decent place to go to when you look at comparing. It's good for me because I can compare, Dr. Zakhary and I can compare different places in the world comparatively based upon, just having a red 4 level. It gets kind of complicated, but this looks at actual peaks and spikes and where they're going from on a 7-day rolling average. So this is one area that I kind of look at when I'm looking at it, and I can actually look at the map and go into the actual country and look at what's going on in that local area. Now you can go to the CDC and find and other, New York Times has a decent one, and so on and so forth. There's many different places that you can go to look at the actual levels of what's going on in COVID in your area, that your actual destination. I'm going to bring up the actual document real quick, and we're going to go through just a few things, and then we're going to open it up for Q&A. And before I open it up to Q&A, I'll ask Dr. Zakhary if she's got anything that she would like to add. So this is the document that U.S. Fencing is going to be posting online for everybody to have. These are just 8 tips for any traveling athlete or any coach or parent that's going with their athlete. And the most important thing that we want to stress is that, we're on a united front. We make sure that we're doing best practices and always wearing a mask when we're in a public setting, as well as staying within a good social distance with the people that we're in contact with. And that's kind of what number 1 is. It's being vaccinated and following those best practices. Number 2, this is just a thing that we've put together of how to be safe on the actual flight. We want to make sure, because most of our time is going to be in the actual airport. If you do need to get something to eat at the airport, obviously grab it and then go to an area that is not that crowded. Being on the tarmac, and not on the tarmac, but on the when you're actually boarding the plane and by the gate is one of the most highly trafficked areas in the airport. So staying away from that area until you need to board is probably the best thing you could do. So we put together a travel kit, things that you could actually bring to make your area safe and clean. Obviously, disinfectants, hand sanitizer, gloves, earplugs, and stuff like that if you want to have just, the basics on you. We talk about beanies and hats, and we'll talk about that when we talk about air supply. So the way that the airflow on a plane actually goes, the best or safest area on a plane is away from a bathroom and also against the window because of the circulation of the air. Actually, all of the air expelled by the passengers goes underneath the feet of the person that is in the window seat. So being in the center of the plane, in the center seat, is probably not the best area to be in if you can choose your seat appropriately. If you can change the air above your head, that is great because the filtration system in the planes is really, really good, and it basically kills everything in the air when it's recycled. So with that said, if you do have a fresh air thing that you can adjust and put a slight breeze over the top of your head, that's why I say beanie and hat, that will kind of push away any exposure to coronavirus in the air from the other passengers. Personal blanket, it's always good to have your own personal stuff. Having your own personal blanket if it's not coming like in a in a plastic bag or anything like that, I would stay away from it. And also with the pillows and the pillowcases that get changed, sometimes they don't always get changed. So just be cognizant of those things. Supplements is something we always recommend for our national team athletes. You know, if you want to sleep, it's always a good idea to sleep on the plane as well during that time. When you actually board the plane and you're looking at your seat, you want to just kind of be aware of what's going on around you. So we always say assess the scene in a medical profession when we're walking into an emergency, because we don't want to put ourselves in harm's way. And that's why we say it here. We don't want you to put yourselves in harm's way. So just be present and look around what's going on. And if there's any other sick passengers around you or anything like that, it's really simple just to, you know, grab a flight attendant and ask them if you can change your seat, or, you know, keep an eye out and let them know why you want to change the seat, and they will try to help you out. And that's where this switch seats there. This gives you a little bit more information of where a safe place on the plane is. How to clean your area. This is really important. A lot of people, you know, they only have like 15 minutes or so to clean a plane and turn it over a lot of times. So it's in, you know, how clean can it actually be? So it doesn't make it, it's not a bad idea to go ahead and clean your area for yourself if you're going to be spending, you know, 6 to 8 hours in a seat. One thing on top of that, we always recommend for our national team athletes, any professional athlete, is sleep and rest. We know that, you know, being tired and traveling decreases your immune system. So lack of sleep and change of sleep will definitely decrease your immune system. We actually recommend for our international athletes, our Olympians, to take about 5 days prior to travel and go to bed about an hour to hour and a half earlier every night or so, so that you can kind of get ready for that time change and jet lag. So you can kind of decrease your up to about 2 hours or so if you can get to bed a little earlier. So your body's, when you get in, you can be more fresh and more ready to go, and that jet lag won't hit you so hard. And if it does, your immune system, you know, if you're really, really tired, you're not sleeping at all, and you just don't sleep on the plane, your immune system will decrease, and that will increase your risk of infection. And that's why we want to make sure we point that out. The last few things on here are airplane and beverages on planes. Since we're international, it's not a bad idea if you take your own food. It's probably going to be more nutritious than the stuff that you have on there. But that's kind of a personal preference. You can kind of go ahead and stay away from that if you want. The reason why we bring it up is because the more that you're familiar with the foods that you put in your body at home, the better you're going to have GI dysfunction when you land. So it's just another stopgap measure to make sure that we don't have anything impeding us to reach our best performance. And having GI dysfunction before you compete is not a good way to go, and it can dehydrate you as well. On number 7, the last thing is we talk about dehydration. Stay hydrated. Continue to drink water on the flight the best you can, and stay hydrated as best you can, because this definitely has a huge effect on your performance. When you get in, you will have an option to get in a taxi or an Uber to go to the hotel, more than likely. This is just a study I pulled up, and it talks about where you're supposed to sit in a car if it's for long periods of time. So you're in a close contact situation for 15 minutes or more. It's not a bad idea to lower the windows a little bit to get a nice circular air flow, so that if somebody is infected, your driver's infected, that air circulates and goes out of the car. And so I threw that in there to keep yourself safe while you're actually traveling. This should say number 9, and it does in the next one that will be posted. Your return to home. And this is the last section that you'll see here. And I wanted to point this out because CDC recommendation is that all fully vaccinated individuals returning home from international travel be tested about 3 to 5 days after your travel. And the reason why they do that is they want to make sure that you don't go back to normal life and you actually have the virus and you could spread it and not even know it without any symptoms. And so that's why they want to say that. I actually included on here if you're not fully vaccinated as well. And then at the very bottom, we have a couple links for resources for international travels from the CDC, as well as that first link that I started with the state.gov for the Smart Traveler Enrollment Program. And so with that, and I want to just say at the end here, if you do, and I'll stop sharing my screen here. If you do have any questions or emergencies or any situation, whether internationally, we want to make sure that you guys have support over there. Feel free to contact me, and I'm available. And if I need to refer you and get Dr. Zakhary and Mount Sinai involved, I definitely will, more than likely, for cases that are appropriate. So if you do have any emergencies while you're on the road associated with COVID-19, just feel free to reach out via my phone number or through my email. And with that said, I want to ask Dr. Zakhary if she would like to add anything. I know I rambled really quick through that entire list, and you guys can read all the fine details, because I think each little thing in that document will give you a good tips on certain things that you can do to decrease your risk on international travel. So Dr. Zakhary?
I think that covers it all, especially at travel, just the simple things that sometimes we might forget, whether you're traveling or here fencing or going on with everyday life. Mask on all the time. We highly recommend, strongly suggest wearing mask underneath the fencing mask while you are fencing. And I know that's something Dr. Summers has been pushing for. Make sure you change out that mask if you become saturated with sweat. One, it's not protecting you as well. And two, it's harder to breathe with a wet mask on. So make sure you're swapping out the masks, take some extra masks with you. Wash your hands between every bout. I mean, every opportunity you have, sanitize your hands, wash your hands, avoid touching your face as much as you can. Again, all the things you would do here to protect yourself, we want to do abroad. A lot of these countries are spiking. A lot of these countries are in the red. So are we. So this is important to do while you're here in the United States as well. We're all still at risk of contracting the virus wherever we are in the world. So we want these to become just good habits to protect ourselves, again, here or abroad. Otherwise, I think Dr. Summers covered the majority of the points that are unique and pertinent to traveling abroad. And we're here and happy to answer any questions you guys might have. I know Kate started answering some in the Q&A as well.
And I'll just add on top of that, if you do happen to get infected and you get tested upon return home, 3 to 5 days after you return home, and you have a positive test, you can look up to quarantine for 10 days after that infection, or until you're symptomatic and you're not shedding that virus anymore. And that's the reason why we always recommend to have testing when you return home, because you could have it and not know it, and you could be potentially infecting others if you're not following best practices. So, Kate, we'll open it up to any questions that anybody might have.
Yep, I can kind of moderate that. We have one in the chat now, so not sure which one of you want to take it. What are the criteria that would you recommend we not travel to a country? And Michelle mentioned, I can't imagine a situation much worse than Bulgaria right now.
Well, I can start with that, and then I'll have Dr. Z chime in. You're correct. There's a lot of countries actually very similar in that region of Bulgaria. In Europe, Europe is spiking pretty hard right now. Bulgaria's numbers are coming down. They've hit their peak and they're coming down right now. What we want to say about, the FIE is holding this event. They're not canceling it. The criteria, what we would want to cancel, why we would cancel an event. So, the CDC says, and this is kind of a roundabout answer, and I hope I'm answering it correctly. Excuse me. The CDC says anything that's a level 4 is 500 per 100 million, right? And you can actually, on the website that I showed you, you can actually see countries that are, dark, blood red, and then black, based upon their density in the public. So the difference between Bulgaria and Estonia, for example, I'm just going to give you an example. So I started looking at the differences in the density in the population, because unfortunately, we don't have the data of where in the country it's spiking. Unfortunately, that doesn't exist right now, especially for like Bulgaria, for example. I can't tell you, like for Sofia, how bad are the infections in specifically in Sofia. It kind of looks at it as the whole country. If you look at Bulgaria right now, it is high. There are a lot of high numbers. But what we want to make sure that you understand in this call, more than anything, is that if you're vaccinated, you're wearing a mask and you're social distancing, your risk is significantly decreased. What puts you at risk is breaking any of those three. And we right now, to be honest with you, we don't know the criteria. What would it take to cancel an event? If the FIU is still holding it, we're still investigating, and this is, an ongoing thing, and we might come up with that criteria. But right now, we feel like so close to the event, we're going to allow athletes and parents and coaches to go and take that risk because it is one. I hope that answers that question. Dr. Z, do you want to add anything on that?
Yeah, and just because I know that at one point when traveling, internationally, we had the medical bubbles, or the best we could do for a medical bubble. We can still do that. We could take those same precautions, try not to go out and eat at these crowded restaurants, try not to go out to eat at all. Let's stay focused, go out there for the competition, eat at the hotel, in our room, pre-packaged food, whatever we can. It sounds awful to be in another country and do these things, but the times we're living in now, and just like Dr. Summers says, that's what's going to keep us safe, is our own makeshift bubble, our own precautions. And it's not the traveling abroad that's the risk, but actually breaking these safety protocols and safety measures. And it is an ongoing, we've been talking for weeks about when do you call it? And I think the best thing we can do is follow CDC guidelines, which say, if you're going to travel to these countries, be vaccinated and take all of these precautions. There are travel bans, so that will come in, and no one on this call can make that decision and say, no, we're still going to travel. If that kicks in, that's a reason not to travel. If these countries then start requiring 2-week quarantines prior to being able to go out and about, compete or whatever, that's a reason not to travel. And I think that on the higher level, the FIU will be following that. But for our cohort and your safety, we are going to continue to follow it and see how things progress and determine if it is unsafe. But based on the numbers now, based on the direction that this trip is going, based on the proximity we are to it, I think that taking these precautions and giving you guys these recommendations and these tools, equipping you with these tools and the knowledge of how to stay safe is our best bet.
Yeah, and I want to say, just like, thank you, Dr. Z. I really appreciate that you adding that in there. If we're going into a really, really high risk area, I really strongly believe that it's our capability to keep ourselves safe as we're vaccinated. So if you don't put yourself in those situations, I think it would be a safe trip to go on. There is associated risk, but I think that if we do everything we can possible to keep ourselves safe, I think it's definitely the way to go. Next question. I hope I answered that one. So next question.
Yeah, thanks, Jeremy. What are your thoughts on using sleep aids to get over jet lag? For example, melatonin.
Dr. Z, go for it.
Yeah, melatonin is actually great. That's the most mild of them. I think using sleep aids to get over jet lag is definitely, it's safe if that's what you're asking. Melatonin would be first line. I would try melatonin starting at a low dose, increasing it up to 10 milligrams if you need to. I know a lot of people are scared to use melatonin at that high of a dose. It is naturally occurring in our body. It isn't something external that we're introducing. So side effects are low. But just to see how it affects you, I'd start at a lower dose, maybe even start at home before traveling and using it. And then you can go to something as heavy duty, I guess, as Benadryl to really help if the melatonin doesn't do it. But if you're someone who is naive to sleep aids, melatonin should do it.
And I would like to kind of just go on top of that and say, just like she said, practice it before you just try it before you compete. And the reason why I practice it, you don't want to introduce something you've never tried before right before you compete. I think it's really important that you don't introduce new things right before a big day. So give it a try, see how your body reacts. And then if it's something that you like and it's something you felt like it helped, that's when I would try it before a trip like that.
And it's very safe. So if you want to increase the dose again, we've seen higher than 10, but that's people with sleep disorders. I don't think that if it's just for jet lag, you can go that high and safe to do so.
Jeremy, are there any concerns about banned substances with an anti-doping?
Yeah, so you want to make sure when you're looking at any supplement, it doesn't matter if it's melatonin or vitamin C or name it, any of them, you want vitamin D. You want to make sure that it's NSF certified, which is a national sport safety thing. We would look for that in WADA, so NSF certified. This is a third-party supplement that has been independently tested and is safe to take, because we know that supplements are not regulated by the FDA. And so you could have a banned substance in that. And also, if you're going to take certain types of sleep aids, or you want to make sure that it is compliant with anti-doping and it doesn't have any banned substance in there. And you can go through Global DRO, www.globaldro.org, and they have a list where you can put in those medications. If it's a supplement, you just need to look to see on the actual supplement itself if it's NSF certified, and you can go online to check NSF certified supplements through USADA. And I think they just changed the 411 supplements link on it, and they call it something else now, or they were going to. And you can check NSF certified supplements for certain things like that, so just to make sure that you don't, have a banned substance in a supplement that was not properly certified. Great question.
Very good question.
Jeremy, there's a question in the chat. What is the FIE policy for ADHD medication?
So ADHD medication is going to fall under WADA. So you will definitely have to go through and do a TUE depending on your medication. So the number one thing that you need to do now is to go to globaldro.org and search your medication. If it is a banned substance in or out of competition, if it's a banned substance in competition, you're going to have to submit and do an application for a TUE. And there is a 4-step process on USADA that says, do I need a TUE? And you click on it and you answer the questions appropriately. And if it says you need a TUE, it is a banned substance, and they consider that a performance enhancing substance or a banned narcotic or something like that. So you would basically need a TUE if that going through that process says that. The prescribing physician will need to fill out the application for the TUE, since they are the prescribing physician, and which is commonly misunderstood. And that application for TUE takes 21 days to get approved once submitted. And there's a lot of criteria within. Dr. Z, have you done a couple of these?
Yeah.
Can you go through the process as a physician and submitting the application for TUE?
I only know the whole filling it out, and then there's clear directions on how to submit it on our end. I don't know pre or post filling out that form, so we have to fill it out. It is your provider should be able to do it. I don't think it'll take someone with specific knowledge of the process.
They can understand it.
Yeah.
Jeremy, I just popped the Global DRO website and also the TUE link in the Q&A there if anybody wants to make reference.
Yeah, I think someone was just asking about the website there too.
Perfect.
Oh.
Perfect. Thank you.
Mm-hmm. Another question, would you recommend wearing genuine N95 masks over KN95 masks, or do KN95 masks offer equivalent protection?
Dr. Z?
N95 are completely airtight, so it makes a seal with your face only if you're actually measured for it. So there are different sizes. There's different N95s, different designs for them. There's the duckbill ones, the rounder ones, and you have to be measured. If anyone has ever done it, it's a hood test where they fit it on they put different sizes on your face. They put a hood over your head and pump in some bitter tasting substance. If you can't taste or smell it, that's how they know it's your size. So if we're talking about an N95 that was properly fit, that is the most protection you'll get. A KN95 is just tightly fitting on the face. So offers possibly more protection than a surgical mask, but a appropriately fit N95 is airtight. So not airtight, you can breathe, but the seal is completely made with your face, so no particles can enter. And again, this is properly fit and has not been overused, saturated, hasn't been exposed to the environment. In the hospital, when we had a shortage of it, we had to properly put it away in specific types of bags to protect it from the environment. So not a straightforward answer, or there is no straightforward answer. It is tough to get fitted for N95s unless you're a healthcare worker. If you have that resource, then yeah, that is the most protection you'll get. It is not equivalent to the KN95 is not equivalent to the N95.
And I just want to add on top of that, we're not fencing with N95 masks. You don't need a fence with a KN95 mask either, unless you really want to.
It's enough for
I think a surgical mask is just good enough, and you guys can get in there and get out. So hopefully that answers that question. But no fencing with an N95, okay?
Yeah, and it's not necessary. Your mask under mask, so wearing a surgical mask, your fencing mask, and then you're ready practicing social distancing. Make sure when you take your mask off, if a referee approaches you as an athlete and they have their mask down, be careful. These are all things we've seen. So it's more important to be wearing a mask, to be in a safe environment, to know that the people around you have their mask on, than mask type while fencing.
Jeremy and Dr. Z, while we wait for another question to come in, just wanted to mention that, and I wrote this in the Q&A as well, but starting January 1st, anybody who participates in a domestic or international event with USA Fencing will be required to be fully vaccinated. We're going to be sending out official announcement on that later this week, but just wanted to give this group that heads up. There will be an exemption process for medical and religious exemptions, but I just wanted to give everybody the heads up that as of January 1st, 2022, that will be required.
That's great news, and we're really excited to hear that. And maybe this, we can re-look at wearing a mask while at competitions. That's a really good. It's really good having everybody vaccinated at an event. It really makes us reevaluate our current mitigation standards. So that's great news.
Yeah, I think it should be comforting to everyone traveling too, knowing that everyone around you is protected and protecting you.
All right. Also, our squad managers, Caitlin and Jennifer, are on the webinar as well, if anybody has any general questions, but we'll stay on for a few more minutes. Feel free to put any questions in the Q&A. Otherwise, thanks so much for joining. Like I said, we'll post this recording online and also send you a link. And we hope you have awesome travels this coming season, and go USA.